sharing with you. All right, you can see. Okay, so the respiratory system. We're going to, what's it say? Yeah, okay. All right, so we're going to get started, and we're going to, like I said, finish this by Monday of next week, because y'all's mod's going to be wrapping up. So this is a whole bunch of words. You got to write it down? No, because it's basically telling you what is the respiratory system. Well, it's how we breathe, right? It's our lungs, and it's the a bunch of other accessory organs working with our lungs to provide oxygen that flows through us, and when gets our heart, our brain stimulated, keeps our tissues alive. So it's a vital without, and we see that now with COVID, how an infection or an ailment of the lungs can debilitate, cause people to become dependent on a machine to breathe for them, or even cause death. So the respiratory system is a vital part of sustaining life. So the main purpose of it, and this is the part you would want to write down, the respiratory system brings in O2, oxygen, and it helps rid the body of carbon dioxide, CO2, and other waste. And that's its purpose. That's its whole entire function. Bringing in the good air, the O2, and letting out the bad, the CO2 and other waste. All right? Now this picture is kind of really cool, because not only does it tell you, hey, this is the part, but this is what it does. So the nose, not only is it for smelling and sinus infections and allergies, but it also helps move air. And our mouth is for, of course, food and air. And then we talk about the nasal cavities, and we'll go into each one of these. But I'm going to post this picture in Teams because I really like it. And it also shows you how many, if you've ever gone to the doctor and they said, oh, you have a URI. You're like, huh? That stands for upper respiratory tract infection. So that means that's anything from here up. So it just means basically you got a cold, snotty nose, sinus issues, something like that. Now, if they say you had a lower respiratory, that's everything from here down. That can be more serious, all right? So our respiratory system is broken into two distinguishable parts. All right, the first thing we're going to start with is our nose. And do I expect you to memorize all of these bits and pieces and parts? No. What I do need you to understand is that, and write down, is that the nose is for smelling and filtering. And we know we get smelling because, right, most of us, that's what we associate when we think about our nose. But the filtering is not something a lot of people think about. But the nose is extremely important to help filter out particles, germs, anything that should not be going into our lungs. And it does that by the tiny little hair and the microscopic little cella that we have inside of the nose. So we're going to talk about that, in more in depth. So just make sure you know the nose is a filter, okay? Not just for smelling. And then the other thing that I'd like to point out is, where's it at? This little thing right here. It is called the eustachian tube orifice. And it's this tiny little hole. And I want you to remember that hole and where it's at, that it's part of the nose. Because later when we learn special senses, we're going to find out that actually it goes all the way into here. So every time you have a baby who goes and sucks their boogies because they don't know how to blow, they're backing up that eustachian tube. That's why a lot of times runny noses and stuff like that lead to ear infections with smaller children. All right, and once again, the nose smelling. It can also change our voice. If you ever heard somebody up north, they have a real nasally accent. And it's important. It helps warm up the air if it's cold outside. But the main thing is it traps the dust, pollen, and other debris that we have floating around the air. This is a picture of that cilia, and they're like little tiny finger-like, and it's all layered inside of each nostril, all the way through the nose and further. And its job is to catch anything that should not be making its way down into the lungs. And that's how you spell it. So make sure you write that down. Cilia, they're just tiny little hair. They're microscopic, so we can't see them, but they're just tiny little hair-like filters. We have them in a lot of other places in our body as well. Two things I want you to learn from this. If you break your nose, we're medical people now, so we're not going to say broken noses. We are going to write this down, and we're going to learn that a broken nose is a deviated septum, because the septum is right here in the middle, and it's what separates the two nasal sides. And we're going to learn that our nostrils are the nares. And if you've ever been around horses, you know that they call that, that's the horse's nares. And if you've ever noticed, like horses, when they're running, the nares flare. Humans do as well. If they're if they're working out or this or that, or if they get real angry, you'll notice nostrils flaring and different things like that. So those are two things you'll want to know. The nose is mainly cartilage. It can be broken. Mine has. And it can be set and put back into place. All right, this is talking about the nasal airway passages. And like I said, I'm not too concerned that you write these down and remember all of these, but just understand that the nose, well, along with filtering, also warms the air, and that's what this is talking about. And they're like little turbines, and they spin the air, and it brings your body temperature and changes the temperature of the air you were breathing in. All right, we're moving on to the sinuses. And the sinuses are hollowed cavities. And you know, I like pictures. Oh, I don't have a picture. How dare me. I don't know how I would not have a picture of the sinuses. Okay, so let's take a look, because how dare I not have this? This is it. Our sinuses, and on a healthy person, right? They are hollowed spaces, and their function is actually to lighten the weight of the skull and to allow for pressure changes inside the skull. And then this is showing you, we know because they are a hollowed space, at times that can get filled. If you get ill, it can get filled with mucus. If it's you have allergies, it can get filled with pollen and mucus and so forth. And if that happens, you can develop sinusitis, or inflammation of the sinuses. There we go. I'll make sure I add that picture to my slide. Many people who have seasonal allergies dread their, the yearly thing that they go through with their sinuses. And some people, it's so bad that they have to be on medication, injections, and different things. Next we're going to talk about is the pharynx. And I'm hoping that I'm very upset with myself. Hold on, let's go back here real quick. All right, let's take a look. So what we're looking at here, we got the nose, and then this technically would be the pharynx is the back of the very far part of the mouth, and then a little bit further. And you can see that from this image here. That's why I wanted you to be able to visualize it. That this area right here, right along in the mouth, and all the way through here is the pharynx. And what it does, you know, a lot of times, if you go in and you have a sore throat, and you're like, oh, doc, my throat hurts, and they test you for strep, and the strep, and it says it's negative, they may diagnose you with something called pharyngitis. And that's basically inflammation of the pharynx, and it's a sore throat. So we have the pharynx because it's used to not only pass food and liquids, but air as well. It's the one area where we're going to have both. So food and air. Now from there, this is where things split, and we do not want our food and liquids going down past the pharynx into the larynx or the trachea, because that would be bad. That can lead to pneumonia. It could lead to lots of other complications. So this is the part here where the pharynx decides, okay, we have a little covering, and this covering is called the epiglottis. And the epiglottis is basically like a little flap. And when it's time to swallow food and drinks, it closes and it blocks the trachea, so it doesn't allow for anything to go into the lungs. And then it allows for everything to move down through the esophagus. So everything has to work properly. Now, there's been a point in time in life when we've been laughing, joking, doing something we shouldn't have been. That's why our parents tell us, don't do that while you're eating, you're going to choke. And that's because, and then we start coughing because what we've done is we accidentally gotten liquid or food or something in this area. And the body's natural response is to stimulate coughing because it's trying to expel what you've mistakenly brought into the trachea, then keep it from the lungs. All right. So this is the main portions of the upper respiratory, and we're moving down a little bit further, like with the epiglottis and the larynx. The larynx is the lay term for it is it's called the voice box, because it's how our voice goes about getting the tone and the resonance and the pitch, and that takes place here in the larynx. And then I'm going to go ahead and move back to my slides, but I want you to visualize from these areas here, the pharynx, the epiglottis flap, and then the larynx or the voice box. We are now moving down to the trachea. You might write the slangs of these down, like larynx, voice box, because the slang term of the trachea is, you'll hear your great granny, they'll call it the windpipe, right? But that's how air is moved through and delivered to the lungs and back out. All right, so we're gonna move back. From the pharynx, the throat, I guess this is why I've got the tonsils here. So we know, we'll talk about tonsils, but they're more of part of our immune system. But when we're looking in the mouth as far as they can become an issue, because if they get swollen, like tonsillitis, to an extreme size, they could actually block the airway. And that's why some emergency surgeries are done, tonsillectomies are done. And then this is showing you different examples. Now this person still has, what we consider a viable airway, but it's getting close. We don't want that. We want to be able to look inside there and see that, there's no type of restriction of airflow and so forth. But I have heard of cases where they've gotten so big that not only did they swell up through this area, it completely blocked. It was like a medical emergency. This picture here is showing pus on the tonsils, and this is usually a sign of a bacterial infection. And we see that, and we know now our tonsils are so vital, as they're like big catcher's mitts, and they catch any type of bacteria and viruses and keep them from moving to our lungs or our digestive and so forth. All right, and we talked about the epiglottis, the flap, right? And we talked about how it flaps over and covers the trachea, or like I said, the lay term or the slang would be windpipe. All right, but we want to get in the habit of calling it the trachea. All right, now there is something, and then I'm going to go back. There is a disease, it's called epiglottitis. And once again, it ends in itis, so that tells us what? There's swelling. So if this, and it's usually seen in children, if this happens, what we see is that this swells so much that it blocks the airway, so no air is getting through, okay? And it is life-threatening, all right? Because if that's swollen shut, the only way to get air would be by making a surgical incision and giving air manually, and that's why sometimes you do see people who've had tracheotomies and different things. We know that the most common cause for this is people who have had type B Hib, and that's why it's really important to keep up with vaccinations with children, because this is a complication from common childhood, illnesses and stuff. We want to make sure that routine Hib vaccinations are, given and kept. It's important. Epiglottitis is rare, but it does happen. It can occur. The signs of it and symptoms: they drool, there's a high-pitched sound, real anxious, and they do what's called tripoding, and we're going to learn about that. But it's where they lean forward and place their hands on their knees, trying to help assist their breathing. And this is an example of a swollen epiglottis. And you can see how it's only a matter of time before this is completely swollen shut. So what they probably did is they took a picture right as they were intubating and passing a tube into the person's trachea so that they could breathe for them. All right, and then we mentioned the larynx, which they also call the voice box. Now, right at the larynx, we notice there is, in men, a pronounced area, and people refer to that as the Adam's apple. What that actually is a lump of thyroid cartilage, and in men, it's usually a little larger due to testosterone, and it's more pronounced. Now, this is a picture, and it shows you what the larynx looks like. It is a C-shaped ring, and we call that the cricoid cartilage. And that's important. If you move on and you go to advanced medicine, you'll know that that's a maneuver that we can use when obtaining airways, is by pressing that cricoid cartilage for innovation. The reason the larynx has this is it prevents something from being too large, but still allows for like large boluses of food and stuff like that to be swallowed and taken down to the esophagus. All right, now we're moving on to where I want to focus on the trachea. Okay, so the trachea is cartilage, and it's about 1 inch wide, and it's about 4.5 inches long, and then it bifurcates, it splits, and its job is the connection from the lungs to our upper respiratory, providing oxygen. And we know that the trachea can be damaged, and we know that because it's just cartilage, it's something that should be protected. You know that, and why in a lot of martial arts, different things like that, they'll make them wear guards around that, and that's like no for fighting and different things, as the no throat punches, because you can damage somebody's trachea and prevent them from being able to pass and move oxygen. If you look at this picture, it's showing you how the trachea splits. And remember, patient's right, patient's left, okay? So we're looking at the right main, and we call this the bronchus. And then there's the left main bronchus, okay? So these are really important. Now from this part, this is where I think the lungs become amazing. They become like trees, and it's fascinating. And this is why I say they look like trees. So here's the trachea, to the right bronchus and the left bronchus. And then from there, they branch to thousands upon thousands of bronchi, tiny little branches, right? And these are all part of delivering air. And from these tiny little branches, or bronchi, then we know that they even go to smaller, even more microscopic, and we reach alveoli, and we'll get to that. But right now we have the trachea, so you should know trachea, bronchus, and then bronchi, okay? Now, bronchioles, I'm gonna go back one, would be like the ending, and there's a really good picture I'll show you, but the very ending of the bronchi, all right? That's when we would reach bronchioles, okay? And they end at a little bitty sac, and that sac we call the alveoli. And this is where oxygen exchange happens and occurs with our blood, and our used hemoglobin is transferred, and because we've taken breath in, gotten a big lung full of O2, and now we're doing that exchange, all right? The average adult, each lung contains about 6 million alveoli. If that lets you know how many that there are. So there are lots and lots and lots of bronchi, or branches, that end in the bronchioles, which lead to the little air sacs, the alveoli. And then this is the picture I wanted you to see. So if we're looking, so we see the bronchus, and then the bronchiole, the bronchus to, now I've got sidetracked, bronchi, and then we see how it terminates at here and starts to split off into smaller areas, the bronchiole. And at the very end of that, that's where we have the alveoli. And this is, then I think my next picture, yes. My next picture shows you how these are all have their own microscopic circulatory, they're through capillaries. And what ends up happening is the blood enters in and the CO2 is pulled out, and the ovuli is then delivers the fresh O2. And so from there, that blood continues back to the heart to be pumped and distributed to the rest of the body. And so if there's 6 million of these, you can imagine how important it is that we keep these in good shape, that we make sure that we don't do things to damage them. Even though we have a lot of them, I think it was 600 million, or what did I say? Yeah, 600 million. So even though there's that many, you still need all of them to have well-functioning, healthy lungs. And we'll talk later about things that can cause damage to them. All right, but one of the things I want you to know, there's something called pulmonary, and this is obviously pulmonary, is dealing with the lungs, and then surfactant. Surfactant is basically like a slippery fluid. And this is one of the things, if a baby's born too soon, premature, because we know that one of the very last things to develop are the ovuli, right? The lungs are formed, but the ovuli haven't budded and fully expanded into their capability. And the pulmonary surfactant hasn't really begun to take place. And what this surfactant does is it prevents friction. It prevents any of, when we breathe, there being any type of friction against the pleura inside the lungs and alveoli to alveoli and that kind of thing. So it's like a lubrication. And this is what I was talking about with the preemies. So a preterm baby, do you see how this is a fully termed and everything's budded. And you see all of the ovuli and everything's functioning and working. But a preemie that's not. So this is why a lot of times babies that are born early do require breathing assistance. And we've developed amazing technologies now where we're able to actually, stimulate an artificial environment for premature babies and keep them alive and have great success, even as young as 24 weeks. Now, even though we've talked about the tree of the lungs, let's talk about the lungs themselves. We know they're spongy, and they're obviously like our balloons of our body, right? And we have one on each side of our chest, and we know that it's separated here at the sternum, and we usually associate the right and left lung, but we think of them as even though they're two separate, they are a functioning unit together. Now, one of the things that's interesting is the left lung is a little bit smaller than the right lung. And if you think about it, it makes sense because we know the way the heart's positioned, because the heart kind of takes up a little room over on the left side, and the lung compensates for that. All right? From the when we start thinking about the lung as giving it directions as far as identifying where something's located, the top portion of the lung, right, we call that the apex. The bottom portion of the lung is the base. So this would be the apex, and this would be the base. Now we know that our lung has layers in the lining, okay? And these lining, we call that pleura. And if you've ever heard of pleurisy, and that can be where fluid or air gets trapped in between and causes painful breathing. All right. We don't want that. There is a lubrication that's there, but we don't want anything foreign, because that can lead to infections and stuff. All right, ventilation is a term I want you to know. To ventilate means to breathe. All right, when we think about ventilation, a lot of times we associate it with mechanical, or we're ventilating, meaning like we're assisting somebody to breathe or giving them aid. But it just basically is, ventilation is the air moving, the mechanical process. All right. We know that when we breathe air in, that is inhalation. So you need to write that down. When air comes in, that is inhalation. And then when air leaves, that is exhalation. And ventilation is breathing. Okay? Now we know that our lungs can't do all of this by themselves. We have a little neat, nifty looking parachute that lays right underneath our lungs, and we call it the diaphragm. And the diaphragm is a really thin muscle, and it separates the thoracic cavity, from here, and the abdominal cavity. And we know that with the aid of the diaphragm and its large size, we know that the intercostal muscles that lay here between our ribs, together they work in allowing our lungs to expand, to take a deep breath, and then to let it out. So these two are constantly working together. I like to think of it as the air elevator, the diaphragm, because it moves up and down as we breathe. All right, and this is just a diagram to help better explain. So inhalation, we're breathing in. All right, and they see the diaphragm is moving up. It's helping. And then, inhalation. We're breathing in, and the diaphragm's moving, and then it assists during exhalation to force the air out where it moves up. And it's a complete cycle. And this cycle continues, and we usually don't have any type of complications with that. We don't have, it's not something we have to think about. It's completely involuntary. Where a problem occurs, and so many of y'all, and I think one of my slides covers this, but if a portion of the spine is damaged, and I know back in paramedic we talked about C3, 4, and 5, keep the diaphragm alive, and that's talking about the cervical spine. Now, if that is damaged, it can sever the connection, the electrical connection that our brain sends to our diaphragm and tells it to help us breathe. And if that happens, a person's put on a ventilator. And so they have to have mechanical ventilation, and we'll get into that. And we talked about that. And lungs. So here's some terms to know. Dyspnea means that you're having difficulty breathing. So make sure you know that. I think those are some of your terms to know. Apnea means that there's no breathing for 19 seconds or longer. All right. Orthopnea. This relates to patient taking a position to help them breathe. And we see this a lot with patients with COPD and severe respiratory problems, that they'll pose themselves like this man's doing. And this is what I was talking about, that tripod. And he's doing that to assist his diaphragm and the intercostal muscles for breathing. And then hypoxia, this term means that there's a lack of O2 throughout the body. The whole body's not getting enough. And then lastly, asphyxia. Asphyxia, to asphyxiate, means to suffocate. All right, that means that you, due to whatever reason, you're unable to breathe. Okay, make sure you know those definitions. And then we're going to stop for the day here. And then tomorrow we're going to pick up and do disorders of the lungs. Thank you for joining lecture. If you haven't done your Survey Monkey, make sure you get it turned in and send me a screenshot of your answers and the done screen. And thank you. And make sure you hang up. Bye.